So today we're going to talk about Standard 5 of the Level 2 Adult Care Apprenticeship. It is about health and safety. It's called How to Promote Health and Wellbeing for Individuals they, or you in this case, support, and your work colleagues as well. We are going to look at in this video we're going to look at about half of these aims. We're going to get as far as hazardous substances, I think, and then we'll cover the last three in another video. So we're going to talk about the responsibilities of yourself, employers and workers and other individuals in the workplace. We're going to talk about knowing how to keep safe in the work environment, knowing what to do if there's an accident or sudden illness, and hazardous substances. So you will need a pen and paper or a Word document on your phone, a laptop, a tablet, anything where you could make notes. You could use an app like Speech Notes if you want to dictate your notes. And this is if you're one of my learners, then I would like you to show me these notes afterwards as well so we can talk about them. So our first item today is understanding the health and safety responsibilities of yourself, the employer, and workers. The first question you would have, if you're doing our workbook, would be to outline legislation and regulations relating to health and safety in adult care. And we've probably talked about this before, but outline does mean to give a little summary, give the main points about something. So in this, you would want to give 2 or 3 main points about each law that you choose. We'd like to have maybe 4 to 5 minimum that you'd mention. So I'm going to run through a couple of them. You can always look up other ones if you want later yourself as well. There are quite a lot down there that would apply to health and safety. Even things like the Equality Act 2010, that can apply to health and safety too, and we'll probably talk about that a little bit when we do equality and inclusion. So, first one, the Health and Safety at Work Act 1974. This law says that everybody is entitled to a safe working environment. It means, under that as well, it means that employers must provide training and carry out risk assessments to make sure everything is safe, and they must also give employees suitable and safe personal protective equipment, or PPE, like gloves or aprons or face masks, free of charge. The next one, the Workplace Health, Safety and Welfare Regulations 1992, that one says that it's about welfare. So some of the main points cover being comfortable at work, so it won't negatively impact your health long term. Like it covers that there must be adequate heating. If there wasn't adequate heating, you could end up being more prone to getting colds or flus, because being cold does seem to have a bit of a suppressing effect on the immune system. It seems to. Nobody knows exactly what's going on, but it seems to. Anyway, so this one says that you must have adequate heating, adequate light. There has to be toilet facilities and drinking water available. We have Personal Protective Equipment at Work Regulations 1992. Again, similar to what I said in the Health and Safety at Work Act, but it is very specifically about PPE. So again, this one says that the employer must provide PPE free of charge. It does say that the employee is responsible for checking their PPE as well, like making sure there's no tears in the gloves, things like that. We have COSH, or the Control of Substances Hazardous to Health Regulations. Usually we just say COSH. This one covers anything that could be a substance hazardous to health. It could be medications, it could be asbestos, it could be cleaning products. This one covers how they should be stored, used and disposed of to make sure it's as safe as possible. You also have RIDOR, or the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations. That one can be a little hard to remember the proper name of it. Most people tend to just say RIDOR and they know what they mean, but a lot of people will struggle to say the proper name of it to you. So that one, if you have seen, hopefully in your workplace there should be an accident book. Some places have moved on to online forums for their reporting system now as well. But it does say if there's an injury, disease, or dangerous occurrence, including near misses, then that should be recorded in the accident book or on the accident form. And it covers when things must be reported further on to the HSE or any other appropriate body as well. You have the Food Safety Act 1990. This one covers the appropriate serving temperature, storage of food, how food should be prepared safely. And you have the Manual Handling Operations Regulations 1992. So this one, it's obviously about manual handling. It covers the employer's responsibilities with regard to providing training and equipment, and it would mention as well the employee's responsibility to use this training and equipment properly. The next job then is to describe the responsibilities for health and safety of you or the worker in general, the employer, others in the work setting, or individuals. Which, when we say individuals, we usually mean service users. So here is where your notepad, your Word doc, or if you're using dictation apps, your dictation app will come in. So you're going to pause for a few minutes and try and think of at least 5 responsibilities for each. I have grouped others and individuals together here. Just for ease, you might want to use a table like I have shown, or you might just use headings, but make sure you're labeling your notes. You want to say responsibilities for health and safety, and then you could do little headings, just yourself, 5 responsibilities, the employer, 5 responsibilities, others and individuals, 5 responsibilities. So pause for a few minutes here. I'm going to assume you've paused, and I'm going to move on and talk about it. If you haven't paused by now, now is the time, because I'm going on to the next slide. Okay, so some responsibilities of the health and social care worker. You have a responsibility to take reasonable care of yourself and others, which includes following policies and procedures like your lone working policies and procedures, manual handling policies, medication policies. It's your responsibility to follow all these policies and procedures. To attend training and put that into practice, to report any faulty equipment or any dangers that you'd see, only doing tasks that you've been trained to do. For instance, even going up a ladder, there is training called working at heights training, and to even go up a ladder, you should have that training really, just to make sure you're safe at work. And of course, correctly using equipment and PPE correctly. Now, for employers, they have, missing a word, excuse that, they have a responsibility to ensure, oh, I'm not missing a word, okay, never mind me. You have a responsibility to ensure a safe work setting, to provide that training that we're talking about for the employees, to provide the PPE and to make sure it's suitable and safe, free of charge, to carry out risk assessments, to put in place policies and procedures, and provide safe work equipment. I haven't mentioned there, but also making sure that tests are carried out in equipment, like making sure that hoists are tested and maintained properly, making sure that you have annual tests done on the fire extinguishers. And lastly, We have responsibilities of others and individuals. When we say others, we mean anyone else, really. It can be other colleagues, other professionals who are visiting, people who are visiting the individuals you work with. It can contractors, anyone coming in for maintenance. They'd all be covered under others in the work setting. So, individuals, for example, have a duty of care towards those who are caring for them. This also applies that there's a certain duty of care for anyone visiting a setting, that they have a duty of care to those that they're interacting with. So this would include not causing any physical or harm or giving verbal abuse or harassment. It's not acceptable. Not causing deliberate damage to property. Accidents will happen, but deliberate damage is a separate story. Again, if a visitor or an individual sees any problems, any hazards, then they should report it too. They have a responsibility to report it. Not causing harm to others by what they do or don't do. The don't do does come back to maybe reporting. If they haven't reported a problem, or if they have seen something that they could sort out themselves, then they really should. And then taking reasonable care of themselves and others. That's a fairly normal one for everywhere. So, looking at your notes, have a look and see how many of them match up to what I've got here. If you have extra ones, that's great. I haven't covered everything, and you'll find that throughout. I'm giving you ideas, I'm not going to cover everything. So, our next section is how to keep safe in the work environment. And we want to describe agreed ways of working for health and safety. And when we say describe, it does mean give some more details, maybe give an example to illustrate the point. So for agreed ways of working, it's the policies and procedures you follow, and they could be under the following headings: risk assessment, care plans, lone working, policies and procedures around PPE, manual handling, signing in and out, or security. So for this, pause for 2 to 3 minutes and write down as many as you can. I'm going to click onto the next slide. Hopefully you've paused. Oh, I'm actually not going to click onto the next slide. I'm going to talk about it here. So, under this, what you could have for, let's say, the signing in and out policy, to describe it, we might say every time that you enter the work setting, whether you're in domiciliary care and you are visiting the office, whether it is a hospital or a care home, you're going to sign in and you're going to sign out. And anyone who's visiting, you'd also encourage them to sign in and out. So you know who's in the building in the event of a fire or any other emergency, that you would know whether to say to the firefighters there's a person in there. And they would then have to consider whether they would go in and look for them or not. Signing in and out is very important for that. Also, if you were in domiciliary care or lone working, signing in and out would be very important so people know where you are. So oftentimes if you're in domiciliary care, for example, you might have an app that you can sign in and out of when you enter or leave a location, or you might be phoning the office to say, I'm here now. And when you're leaving, phoning again to say, I'm done, I'm going. I've kind of covered lone working policies there as well a little bit, haven't I? Okay. You could also talk about manual handling. It depends what you are doing, what you're mostly doing. You could describe your manual handling procedures for using a hoist. You could describe general manual handling procedures such as avoiding manual handling tasks that you don't necessarily have to do, checking the weight of something before you pick it up, If you are moving something from one place for another to another, you don't twist your middle section. You will turn around properly and move to put less strain, especially if it's something that you're doing often. You want to avoid straining your back as much as possible. So for these, pick a few. Again, we'll be looking for 4 to 5 minimum, and give examples of your actual agreed ways of working. You can look up your policies and procedures, and it will help you as well if you need some inspiration on these. But you could talk about how you're using care plans, medication, how you do activities, how you fill in the daily living records, anything like that. All right, next slide. We have identify health and safety tasks that shouldn't be carried out without special training. Now, I mentioned before working at heights. That would be one that you wouldn't want to carry out without special training, because it is a risk. If you fall from a height, it's going to be much worse than just falling from the ground. You might be more unsteady, and if you don't set up your ladder correctly, for instance, you're definitely going to be more unsteady and increase your risk. You don't want to do that. There are a list here. Let's say first aid. There are a lot of myths about how to treat some first aid things, like I don't even want to say it, but like it's still around that there's a myth if somebody is having a seizure that you'd put something in their mouth to stop them swallowing their tongue. You can't really swallow your tongue. You're just likely to injure yourself or injure the person. So it's not a good idea. And that's why we have first aid training. So we're not working on myths, we are working on the same procedures, and we know what to do and what actually works. Same with administering medication. We want everybody to be doing the same thing with medication, including doing things like checking people's identities. Even though you know who it is, and you might have given them their medication yesterday, you check the identity just to be sure, and it does actually reduce mistakes. Same for everything else. Having specialist training reduces the risks. Food handling and preparation is one that I can think of. A lot of the times people come into training for food safety and they don't know about the different temperatures where things are safe. They don't know how long certain foods can be stored for, and when they're at home, they just work on look and smell, and that's up to them when they're at home. But in the workplace, it's different. You have a duty of care, you've got a responsibility for other people. It has to be done according to the standards. Okay, let's look on. Our next item is outline sources of support, information, advice, and guidance relating to health and safety. We've got an outline question again, which means we have to give a little bit of information about it. For this, you could say what kind of information the person or source might be able to give you, or how useful it would be, or how to contact them. That would give us a little bit more information about that source. So if we took your supervisor or your manager, for instance, they'd be able to tell you about internal policies and procedures and training that's available and that might be useful for you. Your policies and procedures themselves, they would cover hopefully mostly everything that you could come across in work, like lone working, like medication, manual handling, anything else like that. And that would be able to clear things up for you. But if not, you can get more information from your manager about explaining some details. You have the Health and Safety Executive, got their website there. I would recommend giving them a visit, and I do like their section on risk assessments in particular. They have some good examples of just sample risk assessments already done up, so you can see how other people do them, what kind of risks might be identified. I thought that was quite good. Health and safety professionals. A lot of companies will have, if they're big companies, they'll have a health and safety officer. Or if they're small companies, they might have a health and safety consultant who comes in and checks the building for any particular hazards that you might not have thought of just for safety. What else could you have? I've got a couple of particular health and safety related courses listed there for you. And we have the government website. That link is for the Health and Safety at Work Act, actually, the full law. That you could read it yourself if you wanted to. There are also summaries available online, which you might find helpful. So, excuse me. We want to know what to do when there's an accident or sudden illness. That's fairly important at work. Hopefully it never comes up, but you want to have an awareness of what to do because in an emergency, you don't want to have to think about it. So we're going to pause for a couple of minutes and try and write down as many as you can think of, at least 5 sudden accidents sudden illnesses or accidents that could occur at work. So you might want to think about different areas in your work that might help, or different activities. So you might want to think about kitchens, bathrooms, are there steps to your work? And what other things might you do? Could it be medication related? Could it be the particular activities? Do you do sports? What could it be? I'm not going to say any more until we go on to the next slide. So pause now. And then going on to the next slide. So here are some that I thought of. Under accidents, slips, trips and falls are the most common cause of injury at work. And it does say, our question does say describe accidents. So for this, you might describe how they might occur, like a wet floor or a loose carpet that somebody could trip over. You might describe the kind of injuries that could come about from a slip, trip or fall, like bruising, broken bones, head injuries are a possibility. We've got a few more there. I have said, again, with the rest of them, skulls, you might think of the kitchen and think of how it might occur. Same with burns, cuts, abrasions, you might think how they could occur, maybe what they look like. And then I did say manual handling accidents. For this, I was thinking about if somebody was using a hoist, it will come under a fall, but if it wasn't set up properly, that person might fall. Or I was also thinking about you yourself. If, say, you were lifting a box, you could drop it on your foot. You could, maybe it's something that you should be wearing like gardening gloves for if it's a bit rough. And it could come about that you might hurt your hands if you weren't wearing the gloves. So that's what I was thinking there. And then over on sudden illnesses, we've got a list there. We do have to describe them, so you might describe the symptoms. For example, heart attack. Typically, people might have trouble breathing, they might have chest pain, might have pain down their left arm, possibly, might be a bit clammy. Just to be aware, a lot of people don't actually have chest pain or pain down their arm. A lot of people actually get what feels like a stomach ache or back pain, and it can be mistaken very easily for something else. So just to be aware of that, but do describe maybe the symptoms, maybe describe the causes, and maybe describe what you do. So I believe we've actually got a question coming up on that, so you don't have to describe what you do here. There we go. Outline the procedures to be followed if an accident or sudden illness should occur. If you've had first aid training, then you'll be familiar with Doctor's ABC, which is clear the area or check for danger. Anyway, remain calm, assess the individuals for injuries. If you have first aid, then is there anything you need to do? If you don't have first aid, or if you're not sure, then it's probably best to skip to the next one. If the person is unresponsive or it's a serious injury, then call 999 and request an ambulance. If it is something that looks like it's just a first aid issue, that needs maybe like a bandage, then you should have a designated first aider at work that you could call. Let's see. And you want to stay with, you never leave, you never leave a sick or injured person while they're waiting for an ambulance. Excuse me. You would observe and note any changes in condition. Let's say if somebody's had a heart attack, if they're getting more, or you suspect somebody's had a heart attack, you can't ever say for sure, just out by yourself. You would be looking for if their breathing's getting more difficult, if they are getting a bit more sluggish and slow to respond. You would keep an eye on that. You might, if they're unresponsive, you might be checking their pulse every couple of minutes and keeping note of the changes if there are any. Providing a full verbal report to medical staff. So what happened in the incident, and is there anything else relevant? Did you see anything beforehand? Do you know if the person has any allergies, if they ate anything that morning? As much information as you can give them. And then you'd complete a full written report yourself and include it in the accident book. All right, we're on to understanding what to do with hazardous substances. First of all, what are hazardous substances? So it could be anything that could cause harm to health or injury. You want to pause again and write down at least 5 examples of hazardous substances in your workplace. Ready? So here are some examples I thought of. So we have bodily fluids, which would include blood, urine, anything else. You'd have sharps, like used injection needles. You'd have used PPE. Once gloves are used, they're probably hazardous at that stage, most likely. Any soiled linen or bedding. O2 canisters. Maybe you're not familiar with them, but there is a risk with them. Like O2 can be very flammable, so you'd want to be careful about how you're storing these, therefore it's a hazardous substance. Copier toner as well, it often has, I believe, heavy metals in it that you don't want that get it, and they can be absorbed through the skin, so you don't want that. Asbestos can be kind of common in older buildings that it's still there because it's not possible to remove it safely. If it's covered up, then people say it's secure and it won't be a problem. It's when it's exposed that it's really a problem. And if there is asbestos in the building, then there are specialists who come in and check it. Any medication is potentially a problem. Like most of us will think of medication as tablets or liquids being potentially hazardous, and we'll store them safely. Medicated creams can also be a problem. I have heard of people who have gotten the medicated creams on their own hands. It's not a good idea. You are also getting a dose of that medication then too. So it's not great. Don't do it. Always use gloves. And make sure it's stored safely like the other medications. We have any clinical waste, like used dressings, cleaning fluids like bleach or detergent. They can be highly corrosive and you don't want them on your skin. Also, if you mix them, they can form into gases. Even if you don't, if you're using cleaning fluids in a non-ventilated area, then that would be hazardous to you. You could potentially get some chemical burns in your lungs or your throat, and you don't want that, or it could just make you dizzy, but again, you don't want that. Other gases like carbon monoxide, you'll often see carbon monoxide alarms. set up these days just in case. They tend to be a good idea. So we want to outline safe practices for storing hazardous substances. Again, it does say outline, so we do have to give a few points on it, the main points. Using hazardous substances and materials or disposing of hazardous substances and materials. It will very much depend on what you are using, but let's say storing hazardous substances or materials. Let's take, for example, cleaning products like bleach or detergent. You should have a kosh cupboard where these are stored, and you would always store them in their original container because it has the ingredients list on it and it has the instructions for using it on it. You never really decant those into anything else because it's never going to be as safe. There is also the issue of some chemicals can interact with different plastics and they can eat through them. The original containers that they have been stored in have been tested to make sure that the product won't eat through that plastic. Ideally, we do like hazardous chemicals to be stored in a metal container because of fires. Metal containers will slow down fires from getting to those chemicals, and if they're flammable, then we want to slow that down. What else can we talk about? We can talk about medication. Medication is stored in most places in a locked safe, and it is signed in and out, isn't it? For using hazardous substances, let's say we're sticking with cleaning fluids, you would follow the instructions on the packet, make sure that they are in a well-ventilated area, using PPE, like a mask if it says to, depending on what it is. If it's really strong stuff, they might say to use a face mask while you're using it. Definitely use gloves. For medication as well, you would talk about checking the person's identity, checking the dosage, making sure you're filling out the MARS form correctly, and making sure that the medication is used according to the prescription and according to the instructions. Then for disposing of hazardous substances, if we're going with, let's say, still sticking with cleaning products, you would dispose of it according to the packaging instructions. If it is medication, you would return that, package it up and return it to the pharmacist if it's not wanted anymore. Let's say clinical waste. Clinical waste goes in the yellow clinical waste bags. And then they should be stored in a locked clinical waste bin, which is collected by a special rubbish disposal, clinical waste rubbish disposal unit to be incinerated. So, pick a few things. I would aim for about 3 and describe how you store, use and dispose of them. So that is the end of part 1. If you're one of my learners, I'd recommend stopping here and filling out your workbook on doing any other research or thinking at this stage. So, thank you for watching. Hope it's been helpful.